Welcome to The Explainer. Today we're diving into something that is quite literally going to change the way you run your care facility. We're going to do a complete step-by-step walkthrough of the Resicare Health License Holder Management Portal. If you manage residential care homes, you already know that keeping track of houses, residents, staff, and finances can turn into a chaotic juggling act real quick. But today, I'm going to show you how this management portal acts as the ultimate mission control for your business. It takes all of that administrative headache and streamlines it into one incredibly powerful, easy-to-use system.
Okay, let's take a quick look at our roadmap for today. First, welcome to the dashboard. Second, setting up rooms and houses. Third, adding and managing residents. Fourth, resident reports and financials. Fifth, onboarding and managing workers. And finally, number 6, handling attendance and payroll.
All right, let's jump right into Section 1. Welcome to the dashboard.
Now, as a license holder, you really need a complete overview of your entire portfolio the absolute second you log in. You don't have time to dig through endless menus to figure out how your business is doing, right? Well, the dashboard features a super clean, intuitive layout that greets you instantly with your facility's vital signs. Everything you need is right there, front and center.
At just a quick glance, you're seeing the big picture. You've got your active houses, total residents, registered workers, assigned doctors, plus a complete financial overview of total expenses and pending resident bills. It is honestly so satisfying to see all those complex daily operations distilled down into a few simple, actionable numbers.
Moving right along to Section 2, setting up rooms and houses.
Before we can bring in any residents, we've got to lay the digital bricks, so to speak. Setting up the configuration is super straightforward. Step 1, you add your room types, like a single private room or a semi-private room. Step 2, you set the baseline monthly pricing for those rooms. And Step 3, you create the actual house identity and assign those physical rooms to the building.
When you're adding that new house identity, putting in things like the house name, phone number, and address, there's one absolutely crucial detail to remember. Each house has to have a specific email address assigned to it. Why? Because those are the exact credentials your staff will need for the House iPad app on site. Once that's set, you just punch in your room configurations. If the building has 4 rooms, you add 4 room units, assign their types, and input their specific monthly charge. Super simple.
Which brings us to Section 3, adding and managing residents.
Okay, so once a resident is added to the system, they get this incredibly comprehensive resident profile. Think of it as your centralized hub. You can finally ditch the giant filing cabinets for contracts, the messy binders for medical notes, and the clunky spreadsheets for billing. It's all neatly organized right here into 4 clean tabs: personal, medical, reports, and financial. It holds everything from basic birth dates to critical, ongoing health conditions.
Under that personal tab, beyond just assigning them to a specific room, compliance becomes a total breeze. You have the option to directly upload their signed contract right into their profile. Snap, upload, and you're done. By storing physical documents securely within the portal, you are never going to worry about misplacing critical paperwork again.
Then we have the Medical tab. This is where the day-to-day care tracking really happens. It cleanly organizes all the active medicines with exact dosage instructions, and it logs ongoing doctor's notes. Even if a doctor checks in on a patient via a quick video chat, those observations are immediately documented right there in the profile for your entire care team to see.
Let's look at Section 4, resident reports and financials.
The weekly progress report pulls together vital signs, caregiver observations, nutrition, sleep, and even mood. But here is why this is a massive deal for you as a facility owner. You can download this as a beautifully formatted PDF. Sending these regular, detailed reports to families is a totally unmatched marketing tool. It differentiates you from competitors by transparently showing families that you genuinely care and are closely monitoring their loved one's well-being.
Next up is the Financial tab. This gives you a crystal clear snapshot of what's been paid and what's pending. And the absolute best part? If there's an outstanding balance, you can securely email a detailed payment request straight to the financially responsible family member. They get the email, they can pay instantly and securely via Stripe, and boom, your system updates automatically.
So, at this point, you've got your facilities built, your rooms priced, and your residents fully enrolled and billed. But it begs a pretty obvious question, doesn't it? Who is actually providing the care? Let's talk about your team.
Section 5, onboarding and managing workers.
Just like your residents, every single worker gets a comprehensive profile. Selecting Add Worker lets you input their contact details, their role, like caregiver staff, and their hourly rate.
But the real game changer here is the documentation section. You can upload resumes, a copy of their driver's license, and any relevant certifications. The whole shebang. Everything is easily verifiable and stored in one secure digital spot.
And this profile setup directly supports your safety and compliance standards. The portal actually offers built-in, optional background check packages right through Resicare Health Partners. You can run a basic, county, or complete report directly from a worker's profile. Even though it's not mandatory, being able to run these comprehensive background checks is a massive asset when marketing your strict safety standards to prospective families.
All right, on to the grand finale. Section 6, Handling Attendance and Payroll.
First, let's peek at the Attendance tab within the worker's profile. Because your staff uses the system to clock in and out at the houses, the portal automatically logs their exact start times, end times, and the total duration work for every single shift. And let me tell you, this is where the real magic starts, because it sets up the next step to be completely effortless.
Generating pay for your workers takes exactly 4 clicks. I'm serious. 1. Select the worker. 2. Select the Payroll tab. 3. Click New Payment. And 4. Click Generate Payment. That is literally it. Let me explain how that actually works.
This is such a massive time saver. You just enter the start and end dates for the pay period, and the system automatically calculates the hours worked directly from that worker's attendance time clock. It multiplies the hours by their hourly rate and projects the gross pay instantly. No more manual math, and absolutely no more chasing down paper timesheets at the end of the week.
To wrap it up, once that payment is generated, it just sits there as pending. After you actually cut the physical check or process the direct deposit, you just select the drop-down menu and change that status from pending to paid. That instantly updates your financial overview on the main dashboard, ensuring your business's financial data is 100% accurate in real time.
And that perfectly brings us to the dashboard's core tagline, providing professional care with a human touch. By mastering the Resicare Health License Holder Portal, you completely eliminate the administrative chaos, the lost paperwork, and those dreaded payroll nightmares, which leaves you with one really important question to think about. If you weren't spending dozens of hours a week managing spreadsheets and chasing down signatures, what could you and your team truly achieve for the people in your care?